My name is Debbie Bell, and I'm the Health Education Coordinator with the Franklin County Health Department. I'd like to thank you for working on wellness with us. Today, we're going to be talking with our environmental health team with the Franklin County Health Department and learning a little bit more about their health services. They are located at the Franklin County Public Health Center at 851 East-West Connector, and their new business hours are 8 to 9:30 a.m. Monday through Friday. Let's take a moment and meet all of our guests. Can you guys tell us your name and your role in environmental health?
I'm Kendra Palmer. I'm the Environmental Health Director here, and I've been here 24 years.
I'm Wes Clark. I'm an environmentalist here, and I've been here 23 years.
Hi, I'm Mark Reed with the Kentucky Department for Public Health, manager of the Food Safety Branch, and a lot of people know us as the State Health Department.
Okay, well, welcome you all, and thanks for taking time out of your busy schedule to speak with us today.
Thanks.
Wes, I'm going to start with you.
Okay.
Can you tell us a little bit about the services that are offered by the environmental team at the Franklin County Health Department?
Yes, we do hotel, motel inspections, caterers, cafeteria, restaurants, food stores, mobile home and RV parks, septic tank truck pumpers, septic systems, swimming pools and spas, tattoo studios, body piercing studios, temporary food booths, youth camps, rabies clinics, food managers and food handler classes, and also investigate potential environmental health hazards.
It's quite a lengthy list of items. Now, Mark, you're with the State Health Department and the Food
Yes.
Safety Branch. Can you tell us a little bit about how you interact at the local level with the Franklin County Health Department and our environmental team?
Sure. Every health department in the state actually has at least one person who is a food safety inspector. We consider those individuals really as our boots on the ground. They're the ones that are doing inspections for us. At the state level, we actually develop the rules, the regulations, the policies and procedures that our inspectors use across the state, including Franklin County. One of the things that we're particularly concerned about at the state level is uniformity, so that an inspector in Pikeville or Franklin County or in Paducah does an inspection pretty much the same way in a uniform manner. And to that end, we provide a lot of the training and development programs for our inspectors. That even includes on-site, in-the-field training on restaurant inspections.
Wow. Now, I know our viewers are probably really interested about these restaurant inspections and hearing a little bit more about those. Can you tell us, how many grocery stores and restaurants are there, in the state that we're talking about here?
Sure, and that number changes from time to time, actually, as new restaurants open and some restaurants, grocery stores close. But on a national scale, there's about 1.2 million restaurants and grocery stores around nationally. In Kentucky, those numbers range or average around 25,000 restaurants and grocery stores, and that ranges from maybe smaller, locally owned businesses all the way to those nationally branded restaurants and fast food facilities that we're aware of.
Wow. Kendra, based on what Mark was telling us, the number of food service establishments and restaurants that must be inspected, how often are we doing this? And is there a state law that indicates when we need to be in these facilities and so forth?
Yes, Debbie. The Food, Drug, and Cosmetic Act mandates that those type of establishments are inspected once routinely every 6 months. That doesn't include follow-up inspections or complaint investigations, but a routine, regular inspection once every 6 months.
Wow. Now, Wes, how many restaurants on average do you inspect in Frankfort and Franklin County?
Well, like Mark said, ours is restaurants open and close. It changes, but approximately about 200 restaurants and eateries in
Right.
Frankfort and Franklin County.
That's quite a few, especially knowing how many times we have to be there based on the law. I know when I go to restaurants and to eat and so forth, I look for general cleanliness when I walk in. It has a table been bust, and is there trash on the floor? Are people wearing gloves? All of those things. But Wes, what particular things are you looking for when you go in?
Well, there's 38 items on the food inspection sheet, or 38 items that can be marked or violations. And one of the first things that when I go in and inspect, I look for is a hand sink, hot and cold running water, and soap and paper towels.
Now, why is this important?
Well, hand washing is one of the leading causes of foodborne illness.
Foodborne illness. Now, that's a great area to kind of lead into next. So, Mark, with that said, foodborne illnesses, what types of foodborne illnesses are we trying to prevent?
There's a number of foodborne illnesses out there that we're concerned about, but primarily they fall into one of three types of organisms: bacteria, viruses, and parasites. And just some examples, actually in terms of foodborne illness in particular, one organism known as norovirus is what the CDC says is probably the leading cause of foodborne illness in the nation. In addition to that, in terms of bacterial pathogens, there's salmonella, which is common in poultry-type items, including undercooked eggs. There's also the Shiga toxin-producing E. coli, such as E. coli 0157H7, commonly found in contaminated ground beef. So those are some concerns of pathogens that we're really concerned about. One of the things I would like to mention, though, is that, as Wes highlighted hand washing earlier, some simple things that we can do both at home and in the restaurant to prevent foodborne illness would be washing your hands thoroughly, not handling ready-to-eat foods with your bare hands, and in the restaurant industry is just not coming to work when you're ill.
Very good tips there. So, on average, how many people truly get sick due to a foodborne illness? What are the statistics out there?
The Centers for Disease Control and Prevention tell us that on average in America there's some 48 million people that succumb to foodborne illness each year. Out of that number, there's some 128,000 hospitalizations, and even death can occur from foodborne illness. And we estimate that there's around 3,000 deaths that occur each year, unfortunately. And the foodborne illness in particular can have devastating effects for what we call the high-risk categories of people. That includes pregnant women, elderly, young children, and those who are already sick, such as cancer patients or those who are immunocompromised. So it's essential that food processors and restaurants provide safe food to consumers. And the point I'd like to make, again, is that for some of these high-risk individuals, foodborne illness could literally be a matter of life or death, and that's why that we want to ensure that food is not mishandled or that it's processed properly and cooked properly in our restaurants and food processing establishments.
You know, it's really interesting. I was eating out just yesterday, and I noticed on the bottom of the menu it made reference to the fact that, you know, consuming undercooked, or, you know, in that case, you know, some of the rare burgers that they had, you know, could put you at risk for developing some of those. So very interesting.
Correct.
How we are really working in multiple sectors to educate the public on those safety risks.
Absolutely.
Good team effort. So, Kendra, on that same note, you know, we heard some pretty large numbers of, you know, hospitalizations and, you know, unfortunately deaths related to these foodborne illnesses. Within our community, how many reports do we receive on an annual basis of foodborne illness?
We have very low reportable diseases concerning foodborne illness. And like Mark touched on, the noroviruses, that's probably the most common, and those are associated generally with nursing homes or extended care facilities. Unfortunately, that is a very vulnerable population, and anybody that works in that industry will tell you, after a major holiday, when families have come to visit, you know, their loved ones, there's usually a wave of norovirus, and you've got a population that's very secluded, and you know they're in there and they're not close to the germs that you and I are every day, shopping and work. But that's a very, very common one, and that's probably the most common. We have a few cases of salmonella and staph and shigella, but it's pretty. We have a pretty low rate in this county, and I'm not sure if, hopefully it's our food handler and food manager classes. We hope that helps a little bit, but I think we have a good team here, and with trying to educate the public on proper hand washing and cross contamination. So, but hopefully that does help. But we, cross our fingers, have had pretty low rates for quite a while.
Well, I definitely think that does speak to the work that you all do, both at the local level and the state level, and ensuring that the restaurants are living up to these standards and so forth, and that you all aren't these offensive people coming in laying down these laws. It's just really to protect.
It's
Protect
exactly.
these consumers. Now, along those same lines, some of these tips that you all are providing, Wes, it sounds like some of these could be very useful in our own kitchens at home. Do you have anything to share with our viewers as far as some of the stuff that we talk to restaurants about that we could be doing in our own homes?
Well, some of the most important things you can do at home is start, of course, with washing your hands. Do not thaw your foods at room temperature. Don't leave them sitting out. You could use different coded cutting boards. That's what restaurants do. Normally they use red for meat, and green is usually produce, and just use different cutting boards for different food items at home, so you don't have cross contamination. And always check the temperature of your food and your refrigerator and your freezer. Make sure all that's always at proper temperature, whether it's cooking or cooling.
There's some terrific ideas.
Yeah, something I'd like to add to that, and he touched on it, was washing produce. That is such a concern, because we've all worked foodborne illnesses cases where it's been a case of unwashed produce, and some of them in the past few years have been very publicized nationally. But that is, you have to think about where produce comes from. It comes from a field. It comes from outside, and the things that it is exposed to. And it's just very important to wash produce. I tell everybody to please wash your produce. So.
This is probably a job hazard for being here almost 16 years now, but it's so funny because when I'm in those grocery stores and I see people pick grapes out of those bags and feed them to their kids right there in the store, I get just a little uncomfortable. But we all have our things.
One thing I would like to add to that too, Wes had touched on temperatures being very important, and it's critical. I always like to emphasize that a metal stem meat thermometer is probably one of the most important kitchen utensils that perhaps we don't have in our kitchens. In addition to our favorite spatulas and our knives and our cutlery, probably really the only way to tell that you've got a food such as poultry or hamburger that's properly cooked is by the use of a metal stem meat thermometer that's working correctly and properly calibrated. And with poultry products in particular, we're looking for a temperature of 165 degrees in the thickest part of that meat. And with hamburgers or ground beef, we're looking for a temperature of about 155 degrees.
Okay, very good. Now, Wes, when we are in these restaurants, I know you're looking for the hand sinks, and we're making sure that they're, keeping their hands clean and so forth. What else are you finding, or what else are we checking for to make sure we're not spreading disease?
Well, we look for insects and rodents, and if worst case scenario we find that, we ask for proof of pest control has been done, and if not, we make them do pest control. We look for, of course, proper temperatures, which we have touched on already, and so proper produce washing, which Kendra mentioned earlier at home. Restaurants are also required to properly wash their produce. Wearing food gloves when needed or required is one of the things we look for. Clean uniforms and hygiene. No one with illness, no employees sick while they're working, and ensuring all food handler certification and food manager certification has been obtained, and they have to show us proof.
Okay. Now, Kendra, how do they go about being trained and getting these certifications for the food handlers or the food managers?
We offer an in-house food handler class here at our Public Health Center building every Wednesday at 9 a.m. It's $5. It's about a 30-minute video and then a little test. And that food handler card is good for a couple of years. It's a very basic food safety class. And we require all people that work in food service establishments to have that. Now, the food manager course, it's through our website. From time to time, we'll have classes in-house, but it's a 4-hour course, and it takes quite a bit of time. But the manager course is online. It's offered in various languages, as is the food handler class online. We offer it in-house, the food handler class in English, Spanish, and Mandarin in-house. They can take it online, and there's like more than 50 languages, which is great. But the manager course online, I believe, is in English and Spanish. It's $135 online, but we'll also accept other county health department or ServSafe certifications on either manager or handler, as long as it's a county in Kentucky, that a county health department that provides that training. And many counties do now. Many counties also offer the manager course, and we'll kind of look at, it's a state code. So most counties provide the same basic information, and like ServSafe, which is a national certification, is going to be equal to our code, and we'll accept that also. But it is required. The manager certification is also good for 2 years, though.
So, Wes, what happens if you are inspecting one of the food service establishments and you find a violation?
Well, ideally, we want them not to find a violation, but if we do, each violation has a point weight or a point system. Mm-hmm. And if a restaurant scores 85% or above with no criticals, that's a passing score.
Okay. So what happens if they're below the 85th?
Well, if they're below an 85% with no criticals, it's a 30-day follow-up. If we go in and we find a critical violation, it's a 10-day follow-up no matter what the score is.
So you give them that amount of time
we give
to
them
fix the problem?
Yes, 10 working days.
Okay, and then here's the question I'd hate to ask, but I know it's a reality. When do you get to the point that you have to close a facility?
We close a facility when they score 59% or below, or if we find an imminent health hazard.
Now, these scores are published as well, correct?
Yes, they are on our website, and the State Journal from time to time will publish scores, but they come by and get those copies of inspections, at whenever they want. It's not, we don't send it to them, they come by and get it, I guess, if they need that information.
Okay. So the public could have access to that,
yeah.
I guess is what I'm saying,
yes.
If they needed it. Some people watch those,
yeah.
Their little grades on the walls when they go in. Of course, I'm probably overly sensitive, so I'm always looking for that A and so forth. Now, Wes spoke a little bit about this imminent health hazard. Can you tell me what would count as a health hazard?
Actually, Wes worked last night an imminent health hazard. He got a call at about 9:30 last night. A restaurant was on fire, so they closed, and that a fire would be deemed an imminent health hazard if it affects the kitchen, the food, anywhere where food is kept, and that's an example. The most common complaint that we receive is sewage backed up on the floor or backed up from a sink or drain, and that is, you close the doors. We'll close, hopefully they'll do it themselves, a facility will, but we will do that immediately. If we find wastewater on the floor or coming up from the drains into a sink or in the bathroom, that is a reason to close the doors and cease operation.
Now, would that complaint have to come from someone within the establishment, or could it be a customer coming in?
Most of the time it's a customer.
Okay.
Unfortunately, most places won't close.
Sure,
they're going to want to try to say, and we would love to see them be more cognizant of, that this is not healthy. We should not expose our employees or the product that we're selling or our customers to these kind of conditions. But unfortunately, it does happen.
So how would someone go about making that complaint?
If it's an imminent health hazard such as that, they can call our office, 502-564-7382, and we will respond immediately to an imminent health hazard. If it's after hours, they can also always call dispatch, and they know how to get a hold of us, as of evident last night. But if it's a general complaint that's not an imminent health hazard, like we get every day, they can also call our office or go to our website and fill out the complaint form and either fax, mail, scan, and email in, or just bring it by. But the general public kind of has to realize we can't. Everything's not an imminent health hazard, and we will respond to things if we're notified properly.
Sure. Now, Wes, you do a lot with restaurants, and just the fact that that the restaurant Kendra was speaking of, it did not catch fire between 8 and 4:30. So your office hours are probably quite different from the average employee. But how else do you help these restaurants? Are there other services that you provide?
Well, when we get new restaurants, we get building plans and we review the plans, and normally we do that between our office hours, 8 and 9:30, and at 9:30 they want us out doing restaurant inspections.
You got a lot of them, don't you?
Yes.
Well, can you all think of anything else that we need to share with our viewers? There's been such great information, and I always learn something when I get to talk with my guests on the show. So can you think of anything else before we close?
I'd like to just commend our Franklin County Health Department partners for a job well done in their environmental services. And having been a health inspector many years ago, I can let you know that it's often a thankless job. We see more people probably frowning at us when we come in the door than they are smiling at us. But I want to emphasize that certainly Wes's job and health department inspectors' jobs across the state are certainly there to protect consumers from food that may have been mishandled or contaminated, but also inspectors are there to protect the establishments, the owners and the managers. Oftentimes I can remember from my own career uncovering some potentially health hazards that the management and owners weren't aware of, and bringing that to their attention to get it fixed before it turned into something major. So.
Well, I definitely think we have a great environmental team as well. And I want to thank you, Mark, Wes, and Kendra, for joining me today and sharing your expertise. For all of you all that are out there watching today, I thank you for tuning in to Working on Wellness. And if you have any questions or you are looking for information about our environmental health services, our team is in the office Monday through Friday from 8 a.m. to 9:30 a.m. And we are located once again at 851 East West Connector. Thanks for watching, and I look forward to seeing you next time.